Director of the International Medical Corps, David Eastman, joins me now live. David, I appreciate you taking the time to speak to us. We just got that report, just came in to us from Derna. It looks, I don't know if you heard me saying that, it looks apocalyptic. You've got teams on the ground. Just give us a sense of what they are telling you.
Our teams entered Derna yesterday. Last night they met with Ministry of Health officials so that we could arrange medical care tomorrow with our medical team working with Ministry of Health health workers. We're rushing medicines in right now, and what they're seeing is, yes, there are dead bodies that are scattered, being cleaned. They described wreckage as if it was a war zone. He said that he saw a car on the third floor of a house that had been thrown up by the water. So the search and rescue efforts is really over at this point. It's cleanup, providing health services, mental health services, care for the survivors.
And so search and rescue, as you said on your side, is over. Medical supplies then, I mean, our team took quite a long time. They did a phone call with us yesterday to try and to get to Derna. How are you moving medicine to that part of the country? Because I know the infrastructure has been seriously hit.
Well, International Medical Corps has been in Libya since 2011. We were the first international aid organization to enter and arrive in Libya when the conflict started in 2011. We've been there ever since. So we have strong relationships. Our team there is Libyan. They were able to procure medicines from Tripoli, where we had our office, and move them across to Benghazi, and then up. Now they're going to be moved to Benghazi and tomorrow to Derna. So a local effort with a lot of professionalism from a decade of experience.
From a medical point of view, then, what kind of injuries or medical assistance most people needing right now?
Well, we're understanding from the Ministry of Health is that the cases of trauma have diminished. Now it's health care for the survivors that needs to continue. Obviously, a lot of people, as the report described, are traumatized. If you can imagine, the estimates of death are between 6,000 and 11,000 out of a population of about 90,000. That's at least 1 in 20 people that's died. So families are torn apart. Children are going to need support. They're seeing their families traumatized. So not only will healthcare be necessary in helping to rebuild the system, working with the Ministry of Health, it's caring for those survivors, helping them to rebuild their lives.
And clearly, you know, with the infrastructure affected, sanitation is a huge problem as well, and there are concerns about waterborne diseases. How worried are you right now about that?
Well, of course, safe water is very important. We're looking at ways that we can help households to sanitize their water and educating people and just basic approaches to that while they're in this situation that they never could have expected. Of course, the cleanup of the dead bodies will be important. The bodies that in and of themselves, let's say, aren't infectious, but the carrying and the handling of those bodies is hazardous. So it'll be important to make sure that any volunteers, any workers, are using safe procedures to protect themselves.
David, we really appreciate you taking the time to speak to us. Wish your team on the ground the very best of luck. Thank them for all their work and effort. We, of course, are thinking of everyone in Libya and will continue to stay on top of this story. Thank you very much.